I'm Dr. Anthony Kaveh, a Stanford and Harvard-trained anesthesiologist and integrative medicine specialist. And today we're going to talk about early onset dementia, what it is, what the signs and symptoms are, the causes, and most importantly, 5 tips that you need to know against this challenging condition. And just look no farther than Chris Hemsworth. He's, after all, the mighty Thor, but he's quite concerned about early onset dementia because of his genetic predisposition. Whether you have the ApoE epsilon 4 mutation that he has or not, you need to know these 5 powerful tips to help reduce your risk. And by the way, Chris has 2 variants of the ApoE gene. So he's at the highest risk, probably the most powerful genetic mutation that we know of that causes dementia. With that said, in medicine, you have to remember that an ounce of prevention is a pound of treatment. And that's why this is so important for you, no matter what stigmas there are socially around dementia or mental health. These are critical to put aside so that you can protect yourself. That's why I'm doing this live, so I can answer some of your questions at the end, because once dementia has kicked in end stage, there is likely no way to reverse it. I have patients every week that come to me, especially for ketamine or NAD therapy, hoping to reverse cognitive impairment. If it's caught early enough, maybe some changes can be made depending on the origin or the cause. But if we wait too late, there is simply no way to treat. Remember that early onset dementia is dementia that occurs in individuals between 18 and 65 years of age. And this is serious. Like any form of dementia, once it's diagnosed, your medical bills skyrocket and patients' net worth decreases by 60% within just a few years of diagnosis, in part because of those medical bills and because we don't have good treatments. Signs and symptoms are very important to look out for, and your doctor will look for these as well. The most important are going to be memory changes versus social changes, and that's because different causes of dementia affect different parts of your brain, whether that's the cognition memory part, like we classically see in Alzheimer's, or if it's the personality changes that might occur in frontotemporal dementia. Now, it's also important to know that other diseases can cause memory problems that might look like dementia. And that's why your doctor needs to look for your movement, any cause of movement disorders, look for heart problems, for example. In fact, some of the most common causes that you need to know about are going to be Alzheimer's, that will affect the memory and cognition primarily, vascular dementia, which is highly related to heart disease, strokes, diabetes that we'll talk about, and then the frontotemporal dementia, which when it affects the frontal parts of your brain can affect your personality, your executive function, and other personality traits that are different, at least at the beginning, than how Alzheimer's affects patients. Now, it's very important to know that other contributors can worsen cognitive problems. So I listed here sleep apnea. If you're not sleeping well at night, you might have memory problems or cognitive problems in the morning. If you have severe depression or severe anxiety, OCD, addictions, etc., these can all cause what's called pseudodementia. We need to rule out these causes of memory impairment before we're going to make a diagnosis of dementia. HIV certainly can lead to dementia, and we know that if we treat HIV, we can help minimize or slow the progression of dementia. And then, of course, tumors in the brain or any mass might cause your memory or your personality to change as well. And very briefly, in terms of testing, before we talk about the 5 powerful tips here, you need to know that your doctor should be looking at your complete blood count, your basic metabolic panel, especially your kidney function, your glucose levels. Your thyroid and liver functions need to be assessed, absolutely. UA there stands for urinalysis. We want to make sure that there's no infection, like a urinary tract infection, which especially in the elderly can contribute to dementia. HSCRP stands for a high sensitivity CRP, because we want to make sure there's no inflammatory cause to the dementia, like an autoimmune disease. Orthostasis refers to standing up quickly, feeling lightheaded, and then potentially passing out. Individuals with severe orthostasis, meaning their blood pressure drops when they stand up suddenly, might be at higher risk of stroke or having vascular dementia. And we need to make sure there's not a cause there that we can address early on. And then, of course, an MRI is to make sure that we don't have any tumors or any other contributors to anatomic distortion that might cause dementia. So before we talk about the 5 tips, just a brief shout out here. If you appreciate me coming on, please hit that like button, share with others what you've learned so you can empower yourself to advocate for your health, especially in the realm of neurodegenerative disease where we don't have any cures. Like we said, Chris Hemsworth has taken his health so seriously after learning about his genetic mutation, just like Angelina Jolie, when she found that she had the BRCA gene mutation for breast cancer, she had a double mastectomy. Well, Chris Hemsworth can't have a double mastectomy for concern of dementia at being at a higher risk, but he did take these lifestyle changes that I want you to know about. So please advocate for your health. And if you appreciate me coming on here, subscribing, keeping up with all my live streams, and considering joining our live Zooms, where in our small sessions, we answer your questions, your more personal questions, you can always sign up for that. The link will be below. In fact, our next private Zoom is coming up in just an hour here. That's Medical Secrets exclusive access. But moving on to the 5 tips. I want to just look at our comments here briefly. Heidi is bringing up a good question by Carrie. Does tinnitus put you at higher risk? We're going to talk about hearing impairment in just a moment. So Nora is asking, can depression lead to dementia? We're going to talk about that as well. And well, Rafi, I very much appreciate your kind comment. Thank you. Is dementia game over? Bored? Like I said at the beginning, it's a very, very good question. Once you have late stage dementia, typically there's no way to reverse that. However, early on, some risk factors can be addressed. We're going to talk about that. That's why I mentioned my ketamine clinic, actually, where patients come with severe psychiatric illness. If we can address that early on, we can sometimes help decrease the risk of dementia ever forming, to help improve cognition using these holistic approaches. But let's get to them right now. So number 1 is addressing alcohol use. We absolutely know that alcohol abuse can increase your risk of dementia. In fact, there's so many metabolic disorders that come from alcohol abuse, all sorts of brain rotting effects. And I don't mean to be crass about this, but it's just the truth. And I just got some slides on this new streaming software here, so I'm really excited to share them with you. Now, not to make light of it, alcohol abuse is serious. It is a disease that needs to be addressed holistically. Often the addict is not just looking for alcohol, there's something else missing in their life. When we can holistically address why the addiction to alcohol is there, not the alcohol, but what else is that person seeking, we can help address the root cause of the addiction and help reduce further brain damage that will increase the risk of dementia. Number 2 is loneliness. So many individuals were asking about depression. Like I said, severe depression, anxiety, OCD, etc., can absolutely increase our social isolation. In fact, some studies try to quantify this as the equivalent of 15 cigarettes a day in terms of its effect on our health, including its effect on our dementia risk, especially early onset dementia. I have so many videos talking about the manifestations physically of loneliness under anesthesia in the operating room with my patients. In my ketamine center, when patients can have transformational changes to address the root causes of loneliness and social isolation, when we can use our holistic treatments that are often very safe to address the root cause of PTSD, depression, etc., we can reduce our social isolation and therefore reduce our risks of dementia. So loneliness is incredibly important to keep in mind, and it's really 5 close friends seen on a frequent basis that appears to be a threshold for most studies quantifying the physical effects and psychological effects of loneliness. I know 5 friends sounds like a lot to so many people, but at least it's a number that we can try to aim for. If it's 3 or 6, probably doesn't matter as much as knowing that there's at least someone out there that cares for you that you can go to in a pinch. Vitamin D is also very important. I'm not too sure why this slide thing looks all messed up there, but this is really important because many studies show that lower vitamin D levels tend to correlate with a greater risk of viral infections. the more viral infections, it appears to correlate to increased dementia risk. Not always, but at least in some studies. And measuring your vitamin D levels is a very important place to start. You talk to your doctor first, of course. Typically, for my patients, I will recommend up to 2,000 IU per day, assuming there's no other medications that are interfering, so that we can at least safely ensure a minimum dose of vitamin D. However, you do not want to go above that, and you certainly want to talk to your doctor before you start any supplements or anything over the counter. Remember that sun is a natural way of getting vitamin D, but if you have a lot of sunblock on, you might not get enough of that absorption. So number 3 is vitamin D levels being adequate, and the blood test can help guide how much orally you need to take in consultation with your doctor. Next is hearing loss, which someone asked about. Specifically, they asked about tinnitus, the ringing in your ears. Well, tinnitus is certainly associated with hearing loss. And for anyone who has deafness or hearing loss, please, you yourself, or if it's a loved one, encourage them to use hearing aids. There's no question that decreased hearing input will decrease brain stimulation and increase the risk of social isolation. So when we use hearing aids, we help increase brain stimulation and increase social interaction. These are so important for anyone who has a hearing problem to be aware of. And then lastly is the cardiovascular or cerebrovascular effects. Now, this is the fancy way, cerebrovascular, of saying your brain and your vascular system, meaning your blood vessels. If this system is damaged, meaning that your blood vessels are narrowing or they have plaque in them, you might have TIAs, which stand for transient ischemic attacks, or strokes, which is like a permanent transient ischemic attack. Heart disease or diabetes. Now, these 3 are super important because we actually can do a tremendous amount to help lower that burden and maybe even prevent them or cure them if something comes up. Diabetes in particular, in some individuals, cure can be established, especially if it's not type 1 diabetes. Now, that being said, the most powerful way of addressing this is with the Mediterranean lifestyle. I don't know why the slide here looks all messed up like that, but it wasn't that way when I first made it. A Mediterranean lifestyle includes the Mediterranean diet and the other aspects that totally include everything we just talked about. What they call conviviality, meaning lots of social interactions, physical activity, adequate sleep, in addition to the Mediterranean diet. It's maybe not a coincidence that everything that we talked about in that list of those 5 powerful tips are addressed in the Mediterranean lifestyle. It's your understanding of what Chris Hemsworth is going so far to his body to help to prevent, because he understands that an ounce of prevention is a pound of treatment. And I want to answer some of your questions now live. Is dementia genetic? Very good question. Like at the beginning, I said there is one gene that's very, very powerfully linked to dementia. That's Chris Hemsworth mutation there, the ApoE4 mutation. But by and large, we believe dementia to be a result of the other causes that I mentioned. Will this airing be available later today? Yes, it will. Does Lion's Mane help? That's a great question. Lion's Mane certainly has evidence about improving our cognitive robustness, if you will, but it might not address the root causes. Very good question. And Heidi, does Ativan long-term use cause dementia? Very good question. As far as I know, I'm not aware of Ativan itself causing dementia, but we know that long-term use of any addictive substance like a benzodiazepine like Ativan can increase the risk of psychiatric illness, and it can lead to potentially social isolation if the underlying anxiety is that severe, and when it interacts with other medications that someone is taking, and those can all increase the risk of dementia. Is dementia hereditary? Another good question. Heidi, thank you for pulling that one up. There are many familial causes, especially in early onset dementia. We don't know the genes yet, but there's no question that when a patient comes to me with concerns for early onset dementia, one of the first things we need to evaluate is whether any other family members also had that, even if they didn't have the ApoE4 gene allele. Very, very good question. And Salty, I'm happy that you're listening. I hope that you're learning something new. If you are, do please hit that like button. And once again, please share with others to help empower yourself and those listening to advocate for their health. Um, why is dementia being talked about more compared to decades ago? What a good question. Dementia rates have increased across the world as the population has gotten older. It's believed to double every like 20 years or so. So across the world, the number is going to skyrocket of people diagnosed with dementia. In the United States, interestingly, dementia prevalence has seemingly gone down. So we're going to have to see how this ends up playing out in the United States. Hopefully, it stays decreasing, but across the world, it inevitably will increase significantly. It's going to be very, very challenging. Thank you so much. Believe it, and it will be. That's very kind of you. Is dementia hard to diagnose? Thank you for pulling that one up. It does involve several neurocognitive tests, typically done on paper. It does take some time to officially diagnose, but the signs and symptoms that we talked about are very important for your doctor to evaluate. Your movement. I didn't mention, but Wilson disease and the copper depositions in the eyes. I can actually show you on this slide here. It kind of got a little messed up here, but if you look at the bottom arrow, you'll see a little ring around the eye, and that can be a comorbid condition. It's called Wilson disease. So the diagnosis involves not only the neurocognitive tests, but also what other diseases are going on, sleep apnea, heart problems, etc. How could I get tested to find out if I have the gene? Well, there are many labs around the United States that can test specifically for the presence of the ApoE epsilon 4 allele. Very good question. And Elena, absolutely. It was a very good question about the tinnitus. I hope I hope you understand that now. Do I think there will be a cure to dementia? Unlikely, because once dementia has kicked in, the brain damage is already done. Similar to other neurodegenerative diseases like Parkinson's disease, where there just are no more neurons left in that part of the brain that are necessary for normal movement, which is why prevention, once again, is so key, and early diagnosis. And Rafi, thank you for asking. Mando is sleeping, actually, to my side. If you'd like, I can grab Mando. You let me know. Severe tinnitus can absolutely cause hearing loss. And like we said, hearing loss decreases brain stimulation and can increase social isolation, which is why hearing aids or cochlear implants or other hearing devices should absolutely be encouraged to be used. War on dogs. There are certain infections that we can get from animals that can lead to brain infections. This is true. That being said, I love my dog. I put her out of the room so she doesn't interrupt our live stream today, but there can certainly be many infections we get from dogs, no question. Is lack absorption of vitamin D at cellular level? I have to take it with K2 as well. Very good question. I actually take a vitamin K2 as well. Not necessarily to enhance my vitamin D absorption, but because of its other potential benefits depending on whether you get enough green leafy vegetables in your diet. But putting vitamin K2 aside, vitamin D absorption, like I said, primarily through the skin when we get it naturally. If you have dark skin, if you're at a northern latitude, I live in San Francisco where I practice, and it's very easy to be deficient in vitamin D, especially with darker colored skin. So absorption of the sunlight to synthesize your own vitamin D is certainly very real. Now, oral absorption varies on a couple variables there, but you need to use your blood testing to determine how much you need to be orally supplementing and when to take more and when to potentially stop to avoid over ingesting vitamin D or having vitamin D toxicity. Josephine, shout out to you. No problem that you're late, but it's very good to see you as well. I heard Alzheimer's disease is being called type 3 diabetes. Do I agree? That's a tough one because there are likely many people that end up developing Alzheimer's who never have blood glucose metabolism problems. So I have a hard time saying it's a diabetes type 3, but diabetes is certainly a risk factor for dementia. So it is related, no question about it. Very, very good question. Shloyo says, getting off alprazolam is tough, and you've been on it for years. I'm so sorry to hear that. And you're absolutely right that alprazolam, brand name Xanax in the United States, is one of the most challenging benzodiazepines to wean off of. And you've had less brain fog since. So that is wonderful to hear. I am so impressed. I hope that you can empower others here, Chloyo177, to also help explore ways to wean off of potent benzodiazepines to regain control over their health. Of course, it takes support. It's not easy, but knowing that it's a possibility can give us hope. Thank you for sharing that. Do you think you'd be at higher risk if you spent your childhood in the hospital and recoveries or sickness at home? Well, that's a good question, Steph. I hope that wasn't you, but regardless, the reason for having many childhood illnesses needs to be considered. And perhaps if there was something that led to medical PTSD when children are in hospital settings for prolonged periods of time, when they're powerless, giant power dynamic with doctors, being confused, not being heard, maybe being gaslit, etc., you can imagine that that could lead to social isolation in adulthood, especially if there's undertreated psychologic or psychiatric illness. And that's independent of the other causes. Maybe there was a heart problem. Maybe there are other conditions that may also be associated with dementia that need to be evaluated. So it depends on the root cause. A prolonged water fast might help. Hey, Jamal, good to see you on here. Intermittent fasting can certainly improve many metabolic markers, especially those that we believe to be related to diabetes. So intermittent fasting should be considered. It's a very, very good question. Bilateral Meniere's disease, says Poison Pond, and severe tinnitus. Well, I am very sorry to hear about that, but I hope that you have found the right support to help address any ways to improve your hearing to minimize the chance of this progressing to dementia. Can Parkinson's turn into dementia? Certainly, there is a correlation there, absolutely. Another reason why detecting Parkinson's early on is so important. Michael J. Fox has done tremendous work in supporting research here. And Heidi wants to see Mando. Well, I will grab Mando before we go. Why is boxing, football, and other sports legal? We already know there's onset of dementia from those blows to the head. Santanis, you are correct. Traumatic brain injury can lead to encephalopathy. There's no question about that. Can it lead to dementia? Yes. Is it one of the more common causes of dementia? No. But there's no question about its severity. And you are right that we should make sure that any athletes are aware of these risks. Very, very good question. Can stem cells help stop dementia? Not as far as I'm aware of. Maybe one day. And Gail, you are so kind. Thank you. Thank you for the kind comments. Any cures for social isolation in this increasingly isolated world? Well, in my work in my ketamine center, we try to address the root causes of isolation, which often are a combination of outward forces like social media, etc., and also inwardly focused forces that cause us to be stuck, insecure, not confident, maybe feeling betrayed trust when we have tried to reach out to others. Holistic ketamine therapy is one of many ways to help induce greater internal support to be able to reach out to the world to expand and increase our external support. But there's many other ways. Like right here, Satyado is saying yoga and dementia. Absolutely. Yoga and mindfulness practices are very powerful. Well, everyone, it is 11:30. We have to go on to our live stream. And, but one more question, Jamal. Thank you for that kind super thanks. Let's answer your question before we go on to our exclusive Zoom in just a couple minutes. I took 78 milligrams of Ativan in one day. That's lorazepam to those outside the United States. Did I cause any permanent brain damage? Well, Jamal, I'm sorry about the circumstances around that. And of course, I can't know for certain. I would say that it's unlikely that a single overdose of a benzodiazepine would lead to dementia. And that's because in the operating room, we effectively turn the brain off with anesthetics. And the risk of dementia is effectively zero from 1 or 2 or 3 times of receiving anesthesia. Assuming there was no overdose or any anoxic brain injury, you'll likely not experience any long-term detriments. But of course, I can't say for certain. I appreciate your vulnerability in sharing that. And as we got him, uh, we will give Mando a treat, I promise. I think he's weighing in around maybe 15 pounds now. I think he'll reach 25 pounds. But that's this is our little. So once again, everyone, thank you for sharing your experiences. Please feel empowered to share what you learned with others. Remember that you have more power over your health than you've probably ever been told. And Mando here with his polydactyly little, oh, he's looking at me, with his polydactyly little feet is waving goodbye. And we'll see you soon, hopefully with Mochi and Karma next time as well. Happy birthday again, or happy belated birthday, Darian. And we will see you guys later. Right, Mando? This guy's huge.